Good afternoon, everyone, and welcome to the South Florida HIMSS program. Today, we have a special guest from ChenMed. We have two outstanding individuals who have been trailblazers in the healthcare arena. And I think today you're going to find something special. You're going to find something out that maybe you have not seen before, and that is the future of healthcare as we merge technology and the value-based care model. As you see by the title, we're going to align the development and business goals to improve patient care. That's really aligning across different executive functions, from the CEO function to the CIO function. So before we get started, just a little housekeeping. If you like to share your LinkedIn profile so we can simulate some type of a networking, obviously if this was we were in person, you'd have an opportunity to exchange some business cards, have some discussion. So we do encourage you to go ahead, drop your LinkedIn profile in, and that way we'll get an understanding of who you are and how we can best serve you now and in the future. If you have any questions, we encourage you to go ahead and put them into the chat so we can get to them as soon as we can. We will have a Q&A period after the general discussion. So with that said, and oh, by the way, if you did not know, my name is Grant McGaw. I am the program chair for South Florida HIMSS, and we've been bringing you some quality programs here for the last year, and we're finishing off our year with this fantastic program with ChenMed. So I'd like to bring up our newly elected president. I think tomorrow starts her first official day as the president of South Florida HIMSS. So I'd like to bring to the podium Ms. Kendall Brown.
Thanks, Grant. And yes, you're right. Tomorrow we transition the board of South Florida HIMSS. So you'll see some new faces and look forward to a meet the board event that we always do. If we could go to the next slide, Vanessa. We couldn't do these programs without our sponsors. We have many, and in the last year, because we are an award-winning chapter, we have had a spike in sponsorships. If you're interested in becoming a sponsor of the chapter, please get in touch with Grant or I, or you can find some more information on the website. Put events like this together without these sponsors, so thank you to our chapter sponsors. Next slide. The South Florida HIMSS chapter has nearly 2,000 members. If you're interested in learning more about membership, you can get in touch with Grant and I and find more information on the website. If you could go to the next slide, Vanessa. There we go. We have some upcoming events. Our national conference, HIMSS, is being hosted in Las Vegas. The dates are there, August 9th a week. We will be having a chapter reception, which will be at the MedSec booth. The booth number is, I think, C309, which is in the cybersecurity area. The slide that's showing on my side, Vanessa, is getting involved. If you could go back to the events that we're going through, I'd appreciate it. So if you are going to be in Vegas at South Florida HIMSS, as we are collaborating and coming together to host a reception, from the latest list of registrations that I've seen for National HIMSS, we've had over 350 Floridians that will be in Las Vegas. So please join the Floridians at the MedSec booth on August 9th, 4:30 to 6:30. And also local to our own chapter here in South Florida, we have our own conference where nearly 300 health IT professionals come together. We're aiming for 350 this year. This will be an in-person event. It's typically held at Signature Grand in Davie, which is where we intend to host the event on November 16th. There will be a full exhibition and speaker opportunities. So stay tuned for more information on that event, but please mark your calendars for November 16th here local to South Florida for our largest conference, Integrate. And we'll be celebrating our 10th year anniversary there, so it will be a party. Next slide. Please, we can't do these events. Grant and I are volunteers of the organization, and we are always looking for leaders at place local to South Florida to become part of the chapter and more involved. So outside of a member, if you want to be more recognized and more involved in the chapter, please, you can scan the barcode there, and it'll take you directly to the website where there's different and more information. About further ado, we'll get into the discussion. I will now introduce Dr. Chris and Hernando from ChenMed. Dr. Chris comes from the local area. He went to school at University of Miami and then went on to a number of other schools like Harvard and Cornell for his medical degrees. And he currently still practices as a cardiologist at the Miami Gardens Florida Medical Center. Dr. Chris is the CEO at ChenMed and a physician-led healthcare practice that is changing the lives of low and moderate income seniors, managing multiple complex conditions through the concierge-style value-based care model that produces 30 to 50% fewer hospitalizations compared to standard primary care. And Dr. Chris has been with ChenMed since 2009, and I won't steal the rest of his thunder through his bio. I'd like to also introduce Fernando Salata. He's the CIO of ChenMed. And ChenMed, again, is one of the fastest growing healthcare providers in the area. Hernando has proven a track record of aligning IT and business strategy, executing with efficiency and scaling a business, as well as building a high-performing team that values company culture. His experience leads developing world-class software products and solutions to drive successful business outcomes. Fernando started his career as an engineer working in software development and infrastructure, where he held several industry certifications. While he originally pursued a technical career track, Fernando's passion for driving business value and leading teams led him to obtain his MBA from the University of Miami, and he now sits on the executive team at ChenMed. So welcome, Hernando and Dr. Chris. I will turn it over to you. We have very exciting words of wisdom from you about the future of healthcare.
Thank you, Kendall. Really looking forward to it. You know, as one of, or if not the leader in value-based care, it's just wonderful to be able to speak to folks in my hometown. Right, most of our conversations are outside of Florida, and to be able to really just engage folks where I grew up is really important, and where I currently live now and plan to live. So let's go and get started. So this is our, just in terms of who we are, our story is very simple. This is not me. It looks like me, but it's a little bit older because it's my dad, right? And, this company was started by my dad. He's a doctor as well, smart. He was the #1 ranked student in the country of Taiwan, has a medical degree, has a PhD, his master's degree. He's all degreed up. And, our family went through this tremendous journey. I don't know how many CEOs that are running, multi-billion-dollar companies that have experienced true poverty. I mean, we were even homeless at one period of time. For almost a year, living on food stamps, Medicaid, in some of the roughest neighborhoods in South Florida. Those of you who've been here a long time, we grew up in the roughest areas of Alapata and Liberty City. So we definitely understand the plight of poverty. But as a family full of doctors, we had the opportunity to go through cancer. My dad actually had a life-threatening diagnosis when they found a big tumor in his head, size of a golf ball. And he was supposed to have 2 months to live. And as a family full of doctors, for the first time, we got to experience healthcare on the other side of the glass. What is it to be receiving healthcare? And we noticed, boy, oh boy, it was really messy, very impersonal, and most of the time, very ineffective. Unfortunately, I used to tell this story and say, talk about my dad's story. But just about a year ago, I would say just under 50 weeks ago, so 2 weeks from now, it'll be a year, I was in the intensive care unit with COVID. And I know what you're thinking, Chris, you don't look like somebody who should be getting really sick with COVID. And the answer is you're right. Actually, right before I came down with COVID, I talked to my assistant and I said, I'm actually at peak triathlon performance because of COVID. I've been training so hard, and I was ready to, really, put up some great numbers because I'm in peak physical condition. And then, of course, hardiness before the fall. That night is the night that I came down with COVID, and I had temperatures of 102 to 103 for the next 10 days up until the time I was in the intensive care unit. And those experiences, those life-changing experiences in which you're not sure if you're going to live or die, and you truly experience what the healthcare system feels like, are revolutionary. If you can just go to the next slide. And so, I personally, my father, myself, my family, we got to experience how broken healthcare is. Let me just let's zoom out for a second, okay? I love talking to friends of mine that come from other industries, and they talk about how important, the food industry is, and how important pharma is, or how important, tech is, and all these different industries. What most people don't realize is the United States healthcare system is the largest business in the world. Think about that. The US healthcare system is 1/5 of the United States economy. It is roughly the size, a little bit bigger maybe, than the country of Germany. In fact, there's only two other countries that are bigger than US healthcare. That's China and Japan, with Germany right neck and neck. US healthcare is twice the size of Russia. So when you're thinking about big businesses, this is what the US healthcare system is. But guess what? It's getting bigger. The cost of healthcare is getting greater. And so we anticipate that it's just a matter of time before US healthcare is a quarter of the American economy. And you would say, listen, I know you guys, we're tech people, right? Tech people always say, I want more value every day. Every day, you have to do things better and you have to do things cheaper. That is the cornerstone of tech. We do everything better every year and we do everything cheaper, right? So, when you had your iPhone 3, you say, no, every year the screen's got to get better. The processor has to improve. And of course, we got to get more value for the dollar. But what we're finding here is that even though that our healthcare costs are 2 to 3 times more than other wealthy nations, we are dead last in terms of results. In fact, if you look at all the wealthy nations, we are ranked number 32 for healthcare outcomes. And our life expectancy over the last 5 years is declining before COVID. So we have a situation here where 1/5 of the United States economy is getting more expensive. It's growing in terms of costs, and you're getting less for your dollar. It is completely the opposite. Let me express to you why we believe this is, and we'll tell you why we think we are the solution, or similar type models to what we're doing are the solution. But we can inspire you to say, hey, this has got to change. So let's talk about that. I have 4 kids. All right, the youngest one's 9 years old. And, I had kids young. But the youngest one's 9 years old. And, before, when they're like 5 or 6, 7 years old, all my children, they go play sports. They're so cute. They go out in a field and they kick the ball around. And I discovered something very interesting. They kick the ball sometimes in their own goal. They can lose every single game in the entire season. Do you know what they get at the end of the season? They get this wonderful thing called a trophy. You can lose every game, kick the ball in your own goal, you get a trophy. But around the age of 8 or 9, guess what happens? You have to sit down your kids and say, I'm sorry, that's not the way the world works. You don't get trophies for trying. You get trophies for winning. You get trophies for achieving a result. Ladies and gentlemen, every other industry in the world goes through this transition except for US healthcare. US healthcare, 1/5 of the United States economy, is still built on trophies for trying. What does that mean? That means if a surgeon shows up to take care of your mother, kills your mother, that surgeon still gets a trophy. If they amputate the wrong leg, they still get a trophy. In fact, we have an economic system in this country in which the sicker people are, the more complications we have, the more diseases they have, the more open heart surgery they have, the more COVID they have, the more money they make. Now, what kind of system is this when you have some of the most beautiful people on the planet, who are the most caring and loving people working in these great institutions, but they only financially win when the population does worse? That is a broken system. And that is what has led to this problem. And so we at ChenMed are holding the flag, running way out ahead of everybody else. And we are saying we must do healthcare in a different way. We cannot win when patients lose, because that is the way the US healthcare system works. The sicker people get, the worse they do, the more uncoordinated it is, the more revenue is created by the system. There's a mal-incentive. It is a completely mal-aligned incentive. So let's go to the next slide here. So what is ChenMed doing about this? Well, here's something crazy. I come out of COVID, and all of a sudden I started getting a bunch of phone calls, and I said, "Great, I'm so glad that you're checking up on me to make sure that I survived." And they said, "No, Chris, I wasn't checking up on you. I called to congratulate you." And I said, "What for?" He says, "Chris, while you were in the hospital with COVID, Fortune magazine chose ChenMed as one of the largest, or one of the 53 companies in the world that's going to change the world." And I said, "What? Fortune magazine thinks that we're going to change the world?" I go, "Who else is on this list?" And then, other people were like, well, there's like Amazon, Google, Alibaba, right? Tesla. So I'm like, Walmart. So I'm like, okay, so not a small, group of companies, and they're all impressive. I got it. How many healthcare companies were? So here's how it broke down. 53 companies in the world that Fortune magazine says is going to change the world. 30 of them are in the United States. Of those 30, 6 are in healthcare. Of the 6, obviously several of them are going to be vaccine makers, because they're going to change the world, right? Over the next 2-3 years, because they're going to try and prevent and cure COVID. But then there's us, a South Florida-based company. And then they actually show a picture of the United States, and they put a dot right in South Florida, and it says ChenMed right there. And they believe that we are going to change the world, and we are the only healthcare provider on that list. What an honor. So what is it that makes ChenMed special? Why does Fortune magazine think that we're going to change the world? Next slide. Here's the reason why. So did you know that the average primary care doctor in this country takes care of around 2,300 patients? But in some of the most underserved communities, that number is 3,000 to 1. 3,000 patients to every one primary care doctor. If you try to call your primary care doctor and you can't get a hold of them, you know why? It's because they're too busy for you. You know why when you're in the office with them, they feel like they're too busy? It's because they are. They're too busy for you. They're not incentivized to actually fix your problem. They're incentivized to show up and see as many patients as possible. So we changed that. We said instead of 2,300 patients to 1, we do 400 patients to 1. And we take care of the sickest patients. We see them every month, and we change the incentive around. We said, listen, docs, I cannot pay you just to show up and see patients, because how do I know you're making a difference? I'm going to pay you to make a difference. I'm going to pay you to take care of, for example, Hernando's mom, and make sure that she is healthier, she is better, she lives longer, and we do that by substantially reducing their hospitalization rates. When seniors go to the hospital, there's a very high likelihood of them dying. Why? Hospitals are the number 3 cause of death. Hospital mistakes are the number 3 cause of death in America today. Okay, so if you can prevent people from going to the hospital and prevent them from getting really sick, you can substantially improve their outcome, and they live longer. So what else do? We have tons of technology that tries to predict who's going to get sick, when they're going to get sick, and what kind of treatment needs to occur in order to prevent them from getting sick. And then we have all this tech that helps us coordinate the care, so that way the right hand knows what the left hand is doing, because that is a big problem within healthcare today. That's why you feel lost in the healthcare system. Tech should be able to help with that. So if tech can help predict who's going to get sick, tech is going to help create the treatment pathways of how to prevent people from getting sick, and how to treat them when they are, if tech is able to coordinate that care, you're going to substantially improve outcomes. And the answer is we do exactly that. We have the leading tech shop in America that is driving value in a value-based care environment for providers. There is nothing like this. And you say, Chris, I know a lot of EMR companies. And I go, great. Every one of those EMR companies, they do the same thing. They went to a board, right? And they said, listen, they went to a customer, the customer, usually a large healthcare system. Healthcare system says, I need $500 million to implement this large EMR system. Eventually it gets to a CFO and a board, and the board says, show me how I'm going to make that money back. I'm going to implement a piece of technology for $500 million. I want you to show me how you can make that money back. And what's the only way that you can make money in a fee-for-service environment? You need more volume. You need more volume. You need more uncoordinated care. You need more sick people. So those systems are going to be fundamentally malaligned with driving prevention, because prevention reduces the income for large systems today. And that's what ChenMed does today. We are in the business of prevention. We drive things towards health. We drive things towards prevention. So healthcare becomes less expensive and people live longer. That is what value-based care means. It means we're going to spend less than everybody else because we can prevent problems. The number one admission in America today is heart failure admissions. I discovered after I got my 5 board certifications that 90+% of heart failure in this country, of those admissions, are entirely preventable. Entirely preventable. Nobody's out there preventing it though. Why? Because there's no incentive to do that. There's no incentive. So we create tons of tech to do that. We have great doctors and we train them how to do that. And right now, we are going to be in 26 cities across America, hopefully adding another 20 to 30 cities over the next 3 years. We should be building centers, roughly 1 every 9 to 10 days across the US. And we are the leader in America today. Next slide. So here's what we're finding out. These are our smaller competitors. They were created in around 2013, 2014, once we proved that these models actually work. And you'd say, Chris, you mean these are your competitors trying to copy what you're doing? And I said, yes. How do you feel about that, Chris? I said, awesome. Awesome, awesome, awesome. We need more people trying to go into value-based care, trying to transform the healthcare system, because we can't have people winning when people do worse. So all of these companies, you look at them, they're trading at multiples that are similar to tech companies, if not more in some cases. And they're all extremely successful. Oak Street went IPO less than a year ago. And now, I know it says 15, now they're worth, I think I checked this morning, it was like 16 or 17 billion. And you say, Chris, wow, there's a lot of interest in this. Yes, because this type of care, value-based care in which we are the leader, now we're multiples larger than some of these companies, okay? I still believe, by the way, they're doing it the right way because they're trying to do what we've already done, which I applaud them and I love that they're doing it and we need more people to do it. But the beautiful thing about this is that people are trying to transform the system. They're trying to make a difference. They're trying to fight 1/5 of the United States GDP. So as we're out there designing technology, we're seeing people join organizations like ours all the time. Now, we are much more tech-enabled than these companies are, right? Because we've been doing it longer and we've invested probably 10 times the amount of money on technology that they have, because we're primarily, we have a really big tech shop here in South Florida. But what makes this special is that when you're thinking about where you want to work, why are doctors coming and lining up to work for us? Well, if you're a doctor, do you want to work for a system that says, hey, you only win when the population does worse, when there's sicker people? Or do you want to work for a system that says, I'm going to make people better, and not only do I make them better, I can prove it. I can prove it. We have evidence to support, and we keep publishing it, that we are 30 to 50% better in terms of mortality, in terms of heart failure admissions, in terms of cancer survival rates, in terms of COVID survival rates, you name it. We do it better than everybody else in our markets today, in all of the markets that we're in today. So which company do you want to work for? Do you want to work for the company that's, by the way, the old taxi companies that are charging $1 million for medallions? Or do you want to work for a company that's going to transform the model? And that's what we're doing every day. And that is the reason why that Fortune magazine thinks that we're going to change the world. And we do this transformational model in the poorest neighborhoods in America today, because we primarily take care of the old, the poor, and the sick, because that's where the greatest need for healthcare is. And what we're discovering right now is that we are equalizing racial disparities for healthcare outcomes. What does that mean? I don't know if you guys know this, but in every city in America today, there are zip codes that are lower income, most of them minorities. And there are zip codes with higher incomes. Most of them have very few minorities. And the life expectancy difference between those lower income, minority heavy zip codes is 20 to 30 years less than in richer neighborhoods. Think about that. Where you see hospitals opening up facilities in those neighborhoods, the life expectancy is 20 to 30 times higher than the neighborhoods that you see hospitals closing down facilities and that are deeply underserved. And that 20 to 30 year difference means less life. In this country where we talk about equality, poor people, minority people get less life. At ChenMed, because we've experienced true poverty in those neighborhoods, we said that cannot stand. So we're taking this care model and we're going to try to hit every one of those underserved communities in America. There's only about 500 to 600 of them that have such low life expectancies. And we're going to champion and go after that social justice in those neighborhoods with this transformative model, with this unbelievable tech. And that is what ChenMed does. We believe we can change the world. We need to start with the US first. Hernando?
Thank you, Dr. Chris. That was awesome. Hard act to follow, by the way. Love the energy. And so how do we do this, right? And where does technology come in, at least for us, and what we believe is the way that technology should really be looked at, even in other companies throughout the country. The way we do this is that the mentality has to change. And so what do I mean by that? Well, it starts with the CEO first. And the question I would ask to the CEO is, where are you investing your capital? Do you see technology as a cost or as a competitive advantage? And it's important to understand the technical capabilities of what your technology organization can drive. And as an example, Dr. Chris, he actually goes and visits the tech shop and asks, what are we working on? What are we up to? What's next? What's the innovation? He understands the process of the Scrum teams and building how we develop software based on personas of the organization. And that involvement, that engagement, and that partnership is absolutely critical. And I believe that companies that don't have that partnership between the technology leader and the CEO just cannot be successful. Then the second thing is for the technology leader or leaders, for those of you who may not be the CIO, but you're a technology leader in your own right, you have to understand the business. You have to understand the business. And not at a high level, but you have to go deep into the business and understand the business. Second thing is you have to become a business partner. You have to build trust. So how do I do that? Well, back to understanding the business. Why would a business stakeholder listen to a technology leader that doesn't understand the business? That's where the disconnect ends up happening. And you have to understand the different levers that drive your specific business. And I'll give you an example. So I hear some technology leaders say things like, I just need the business to tell me what they want and then I can go build it. Here's the problem with that. If you asked a mail carrier in the early 1900s, what do you need? Tell me what you need. They would probably tell you a faster horse. When in reality, if you understood the business and then you understood the capabilities of technology, you would probably say, you know what? We can actually build you a vehicle and you can deliver mail that much faster and that much more efficiently. You are uniquely positioned as the technology leader of understanding the business once you do, and understanding the art of the possible. And then those two together is what's going to help you drive business value. So next slide. So we at ChenMed, we run technology really as a business. And some questions that need to be asked is, if someone says, we want to build X, the question you should be asking is that helping us achieve actual business outcomes? Is that creating ROI? You have to measure everything. and then make data-driven decisions that are going to move those different levers. And not for the sake of just technology, because I hear this all the time. I go to conferences and I talk to other folks. I want to do this and I want to create that. And in reality, you should be the pillar of innovation by understanding the business, having that strong partnership, and then understanding the art of the possible. All right, so let's jump into value-based care and why we build our own technology here at ChenMed. The first thing, well, Dr. Chris already talked about fee-for-service, so I won't go into that. Ultimately, the point is that the goals are different. So we couldn't just take something off the shelf where the goals are based on volume and based on transaction. And I'll give you an example. You go to the hospital and they put a wristband on your wrist. And at every single station, they scan your wristband. The purpose of that is so that they can capture exactly what procedure was done, exactly what medication was given, so that they could then in turn bill the insurance company, right? Which I get it, hospitals are needed. But we couldn't take those systems that were designed for that model and try to conform it to ourselves. It just wouldn't work. The second thing to note is that we believe that clinical care accounts for only 15% of the patient's overall health. So it's not complete, right? If clinical care is only 15% of the patient's overall health, what are those other things? The first is genetic code. We can't do anything about that yet, but over time, I think there'll be some things to come there. Zip codes, which are social determinants of health and socioeconomic factors like Dr. Chris talked about. And then finally, behaviors. And with the last two, we believe, and we are, doing something about those things. If we can build technology that can positively influence the behaviors of our clinicians, give them the support that they need, and we can positively influence patients, that's how technology can now drive the outcomes that Dr. Chris was referring to. Next slide. So, in contrast, what is a fee-for-service doctor and what are the things that they're responsible for? High volume. They're getting a ton of patients, right? And so they only get to spend a little bit of time per patient. The next thing is they're responsible for referring that downstream process, referring to those downstream events, such as I'm going to refer you to this specialist, I'm going to refer you to that specialist. And ultimately what ends up happening in the traditional fee-for-service model is that the PCP isn't the quarterback of all of those transactions. I can't tell you how many times a PCP doesn't even know that the patient may have gone to see a specialist. They may not know that there were labs that were run and some things that the patient should be concerned about, not just for that particular specialty, but perhaps for another specialty would care about those results. And if there isn't a quarterback that's coordinating all of these things, the system becomes broken and it becomes very difficult for the patient to navigate. I've personally spoken to patients and I can't tell you how many times they tell me, no one knows what's going on. I call this person and they refer me to somebody else and then I call them and they have no idea what I'm talking about and like who is running the entire effort. And the answer is, unfortunately, in the fee-for-service model, everyone's accountable. And I say unfortunately because, well, Hernando, isn't that good? Everyone's accountable. What's the problem, especially for you technologists? What happens when everyone's accountable? If I told you that you had multiple business stakeholders, and they're all accountable, who ends up being accountable? Unfortunately, no one. And so that's the problem with that model, and it's very difficult to practice medicine. There's a lot of amazing people in that model, in the system that unfortunately is broken. And so what we've done at ChenMed is, hey, PCP, you're going to have to be the quarterback of all of these things, and you're going to have to understand the entire life cycle of that patient from beginning to end, not just their clinical outcomes, like we talked about, that's 15%. You better understand how to drive behaviors. You need to understand where that person is coming from. You need to understand what's going on at home. I'll tell you some pretty cool stories during COVID. We had some of our clinical care teams actually delivering food at the homes of some of these patients. Why? Because if they don't eat and they can't go out because they're seniors and they're afraid of contracting COVID, and that's the demographic that was impacted the most, so they can't leave their homes, they haven't eaten, and it's how do we take care of those folks? Well, let's bring them something to eat because they haven't eaten in a few days. That's the kind of care that we're talking about. So how do we build a technology ecosystem that can enable all of this and enable our PCPs? Well, it's actually very complex. There's a lot of things going on because of the complexity of all of the things that, if you look on the right-hand side, that's one of our doctors. That's actually one of our actual doctors, not just a photo we downloaded online. And they're concerned about everything that's being referred, all of the medications that the patient is taking, not just if we gave them the medication, but anybody that's given them this medication, coordinating if they ever go into the hospital, trying to improve their outcomes. They have to quarterback with specialists, all these things. And so we had to take something that's extremely complex and make it very, very simple. And so we built a platform, a custom built platform that does just that, but makes it very, very simple so that the PCP, by way of just coming in and following the process and getting all of this decision support from the technology, they're able to provide better outcomes for patients. Next slide. And so what does ChenMed's technology suite actually consist of? We build specifically for value-based care. I'll start from left to right and I'll walk you through it. Value-based care, what does that mean? All the things we talked about, looking at behaviors, looking at social determinants of health, looking at their lifestyle, and looking at their clinical outcomes. And we build it specifically to try to be proactive. It's funny, when I go to the doctor or my normal PCP, because now I have a ChenMed PCP, but before that, I'd go to the doctor and the doctor would ask, okay, this is your yearly checkup. What's wrong with you? Is there anything that's ailing you? And I would say, well, nothing that superficially I can think of, but I kind of want to know a little bit more than that, right? Tell me what's going on under the covers. And so that's what we try to do. It's not waiting for something to go wrong to then try to fix it, but really being proactive in the total life cycle of care for that patient. The second thing is we have to be holistic. So we look at diet, we look at their lifestyle, we look at everything of that patient, and that's how we conclude what it is that we need to build. And then we have an amazing analytics team that creates insights for our providers, but it's not good enough to just create a bunch of insights and send them a report. That's not good enough. It won't work. And I see that in some organizations, unfortunately, and they struggle as a result, because if you're doing your job, it doesn't matter whether you're a PCP or in some other field, and you're expected to leave your existing workflow and then go somewhere else and read a report, and then that's what's supposed to tell you exactly what you need to do. It just doesn't work. So we had to make it all integrated into the daily workflow, and then finally make it actionable so that as I'm seeing a patient, recommendations are being made on things that we should be paying attention to. We make it actionable so that the physician or the care team can say, you know what? I think we need to see this patient more often. Why? Because we've risk stratified and we understand that based on all of these inputs from this patient, we believe that this patient should be seen more often versus less often. So we're going to go ahead and schedule them for a follow-up visit that's even sooner than a traditional patient call it. And that's how we do what we do. And that's why we've been successful by having amazing PCPs with the right mentality, amazing care teams, and then technology that couples in and empowers them to do what they do for our patients. So I know that was a lot. I think there were a lot of questions. I wasn't reading them all, but Kendall or Grant, I'll pass it over to you and see if folks want to ask some questions, and we can field as many as possible.
Yeah, this is great. Thank you for your words of wisdom to both of you. Very intriguing information here. And I can agree that and feel your passion. Why I'm in the healthcare IT industry is to help and improve the healthcare environment so that when I'm a patient and when my parents are patients, things are more transparent. So We do have a couple of questions. Louis Morad asked, do you use machine learning to do your predictions? And if you do you build your own models or do you use prepackaged models from software providers?
The way that we go about, we do our own machine learning, we do our own AI and analytics. And the way that we go about thinking about that is it part of our core business? And is it going to drive core competency? Or is this something that we can just buy off the shelf? And that's why we custom build almost anything that is adding value to our core competency, which is trying to improve those patient outcomes. So yes, we do, and we build it all in-house.
Great. And Mari asked, what are some of your methodology for unnecessary hospitalizations where patients decide to go to the ER even during office hours?
Beautiful. I'll take that one. It's interesting. Remember, we don't need to prevent 100% of them. We try to prevent 100% of them, and we end up preventing about half. And so how do you prevent patients from getting really sick and going to the hospital? Now, I would say it's probably several fold. So first things first, you got to provide access. All right. Patients are going to go to the emergency room when their pinky hurts. If they can't get a hold of a doctor. My father-in-law, he had the flu once, and I go, you got to go see a doctor. And he goes, yeah, it's going to take me about 6 weeks to get an appointment. Either I'm dead or I'm already cured. But that's my only option. So I go, where else are you going to go? One of the things that we did at ChenMed just yesterday, Hernando, this is amazing. We have Hernando, he's a CIO, and he helped open our employee health clinic. The same care that we're going to give to our patients, we opened one in South Florida for our employees because we were giving concierge level care to our patients and we didn't have it ourselves. I got out of the hospital and said, I don't really have a doctor. Who's going to take care of me? Who's going to take care of Hernando? Who's going to take care of all these people from ChenMed? And so, first of all, you got to provide access. If you don't provide access, and especially in these neighborhoods that are deeply underserved, there's only one place that can go for anything, and that's the emergency room. Second thing is, those who do have major medical problems or major illnesses, you got to get on top of it. Before somebody shows up in the emergency room with heart failure or with blood sugars out of control, they're sick for at least 1 to 2 or 3 weeks before, long before they show up in the hospital. So you've got to see them proactively. You don't wait until they can't breathe and you go, oh, let me help you. You said, wait, let me control your blood pressure. Something as simple, blood pressure. Let me control your blood pressure, because when your blood pressure goes up, you're going to get heart failure. No question, because the heart has to pump against all that pressure. So you've got to lower the blood pressure, and that just takes simple, good old-fashioned preventative care. And of course, you need a tech to help predict who needs to be seen how often. Okay? You'd be shocked. Doctors do not know how to prevent problems. Let me say that again. Doctors do not know how to prevent problems. Ladies and gentlemen, I had 5 board certifications in cardiovascular diseases. I went to top places in the country to train. And you ask any heart doctor, they'll tell you, 75, even 85, or even 90% of heart disease is preventable with good lifestyles and behaviors. And you say, great, Chris, I'm so happy that heart disease, the number one cause of death, the number one cause of admissions, the number one cost in this country is 80, 90% preventable. Beautiful. How many classes in your close to 15 years of schooling, intense schooling, did you take about preventing, heart disease through lifestyles and behaviors? Not even 1 minute. Not 1 minute of classes. So we've got to retrain doctors. We've got to give them technology that allows them to do what we need them to do in terms of preventing problems. And that's how we make a difference.
Awesome. And in terms of improving provider experience, how do you go about doing this while engaging the patient and aligning that with your EMR?
Yeah, really simple. So first of all of our patients get their doctor's cell phone numbers. Okay. So even though it's off hours, you can pick up the phone and you can call your doctor. This is what you want for your mom. Okay. If anything happens to your mom and they get sick, your mom's doctor presents your mom's case to all of their peers to say, what could we have done? And that's called accountability. When you have to present every time somebody gets sick to your peers, you're like, wait a second, as a doctor, everybody, all my colleagues around me are gonna know what I did and what I didn't do or what I missed. And we can learn from that together. We take all that learning and then we embed that into the technology and we embed that into the workflow. Okay, so I'll give you an example. Right now, if your mother falls and she breaks her hip, she has a 50-50 shot of surviving at 6 months. Did you guys know that? The worst cancer in the planet is called pancreatic cancer, stage 4. It's everybody's nightmare, okay? Everybody's nightmare to get stage 4 pancreatic cancer. Do you know what the 6-month survival is for stage 4 pancreatic cancer? 50%. So a senior falling and breaking their hip has the same life expectancy as somebody with stage 4 pancreatic cancer. So at ChenMed, we have technology that can predict with a 71% certainty that somebody's going to fall in the next 30 days. Those are predictive analytics. And then we embed that into the workflow. So that way, as your mom is walking through the center, everybody knows that she's at risk for falling. It's in the workflow. And we will do different, and we don't have all the time to talk about the interventions that are built into the technology and built into the work stream and built into the clinical care that prevents that fall. And there's a lot of things that we can do. But the key is that we had to invent the system because who's out there trying to prevent falls? A hospital makes $20,000 when there's a fall. Okay? It makes $20,000. Every time there's a fall, you break your hip, $20,000. But we've got to do that. And we've got to create technology that does that. Analytics, workflow, EMR systems, it's all embedded. We can spend 2 days talking about the tech.
All right. Sophia asks, where do you pull your data from? And do you integrate with EMR such as Epic and Athena Health and all of the other national ones?
This is so cool. So
yeah, these are all, go for it, Chris. These are all great questions.
Hernando, talk about the complete picture, the complete data picture of the patient, which we are one of the few companies in the country that have a complete data picture.
That's such a great question. So here's the other issue with healthcare, right? And why interoperability has been, Kendall was telling me the other day that she's been in this business for a very long time, and we're still talking about interoperability. Unfortunately, there isn't an incentive for all of these folks to give up their data, right? Even though it's not really their data, it really belongs to the patient. But the good thing is that we're uniquely positioned right in the middle, because the payers and the insurance companies, they have a data set. And then you have the health information exchanges and they have a data set. And then you have the hospital systems and they have a data set. And then all of the different specialists have their own data. And so we take all of this data from all of these places and we make correlations between the data that we are collecting about our patients. And that's how we're driving these insights that are now integrated and then actionable so that we can put plans together to help our physicians make even better decisions about our patients.
Perfect. And Matt Hernandez compliments Dr. Chen. He says it's refreshing to hear a clinical leader talk about proactive and preventative healthcare, and I would agree with that. He also asked, can you further explain how you coordinate with social services organizations to fulfill the needs of underserved patients in your care?
Matt, actually, first of all, remember, our jobs is not only the clinical care, right? You have to do lifestyles and behaviors. We have to, that if a patient all of our patients get included free, door to doctor transportation. So we send Uber or whoever it is, or our vehicles to their houses. If they need toilet paper, we'll get that as well. Some of them don't have food, some of them don't have a place to stay. So we have, all these resources in the centers. And they're part of something called a care team. And those care teams then go to each one of these patients and find out their unique needs. We could have some patients that their grandson is stealing their Social Security check, or they're feeling unsafe at home, or they're eating an entire bucket of fried chicken every single night and they have heart failure, okay? So they have varying degrees of complexity. It is our job to build these care teams enabled by end-to-end technology at the point of care all the way up and beyond that to actually create the solutions that will substantially improve the health of each of these patients. You cannot be completely descriptive. The key is to find the right talent and give them the right insights and technology so that way they can make the right decisions. Can't do it for them. Hope that helps. Love your company as well, Unite Us. We're reaching out to them as well because we're growing so fast that we're looking for resources that we can work with in all these cities that we're in that can help get us more access to these other social services. They help us care better for our patients. And we'll figure out ways to embed that into the technology as well because, you know, guys, we love tech.
And a great follow-on question to that would be from Chris, and he wants to know, how do you present the actionable data to the providers at the point of care?
Fernando, why don't you answer this?
Yeah, I'll take that one. So that's a great question. The best way to look at it is this. Imagine if there was a car and the speedometer was a report that you got when you got home. So you don't actually have a speedometer and you get home and it says, hey, by the way, you drove 78 miles an hour and you were in a 70 mile an hour zone. And you also drove through a school zone that was 30 miles an hour and you were going 50 miles an hour. And then the next day you have to try to remember that, hey, let me not do those things. That doesn't work, right? So you got to have the speedometer right in the vehicle as you're driving it so that you can see it in real time. That's ultimately what we do. So we take all of this information. Remember, I talked about HIEs, and yes, we do take data from all the other EMRs that the hospital systems use, and we take all this data from all over the place, and it's very, very complex. Back to the speedometer example, imagine getting the raw readings from the vehicle as you're driving, and you're trying to interpret this stuff. No, you just need a simple gauge that has a needle, and it tells you exactly how fast you're going. The vehicle is the one that's interpreting all of this and putting it together and making it very simple. In technology, you have to do the exact same thing. You have to make it simple. So we take all of these inputs, we synthesize it, we select out the pieces that are going to be most important, and then as the physician is with the patient, they can be seeing it in real time. So for example, we talked about a risk score. While a physician is seeing the patient, they see, wow, this is interesting. The analytics is telling me that I should be worried a little bit more than normal with this patient. You know what, Mrs. Smith? Let me ask you some additional questions. And you know what? I want to see you in 2 weeks, not 6 months from now or even a month from now. And so making it actionable and integrated while they're seeing the patient, that's how this works. That's why it's so critical.
Perfect. And Zahid, Ali, what are the different scoring mechanisms used to access the risk levels of the patients? I think that's a nice follow-on question.
Yeah, we have, I mean, we have a lot of data scientists. I mean, what do we have? Over 100 of these data scientists that are just brilliant. And, you know, we could spend a lot of time talking about that. The important thing is, yes, you need machine learning. In order to get machine learning and build, you know, great analytics, you need to have great data sets and you need to have a complete picture of the data, which we have. So the answer is, there's a lot going into it.
I think we're taking about 60 something inputs right now, Dr. Chris. So about 60 something, to your point, it's a lot of data that we're bringing in from as many places as we can get it. I think the future is even bringing in data from wearables and combining it with all of this other data. The point is, the more inputs that we can capture about an individual and specifically a patient, the more you know about them. And the more you know about them, the better that you can be in being proactive in their care.
See, you know, we're not nearly as frustrated with interoperability. Here's the reason why. I mean, we have that complete data set. You know, a lot of folks, the technology is designed to do something else. If you have a technology system in a hospital, your number one goal is, how do I see as many patients as possible in a given period of time? Number one. Number two, how do I capture as many bills as possible at the highest possible rate? That's your goal. What's the third thing? How do I make sure that there is as little leakage? That means I do as many MRIs and CAT scans and specialty referrals and procedures. How do I capture as many of those as possible and make sure they don't go to another hospital or another facility. I want all that. So you want to know why interoperability is such a challenge in healthcare? Who wants to give up their data? If you give up your data, you give up the patient, and the patient can go somewhere else. You want to capture that patient within your system to maximize the billable revenue. That's the goal of that technology. What we're going to use data for is completely different. We're not using data to see if we can capture the patient so that way we can do as many things. We're going to use that data to see if we can predict and change the clinical outcome of that patient so we can prevent all of these things downstream. That's the goal. So, and it's really interesting. We love, again, these hospital systems are full of the most amazing people. So when they hear what we're trying to do, they go, okay, how do I get you the data? Because actually, we love what you're doing. We're very frustrated with the system that we're working in. That's the reason why that our technology group, we keep growing like crazy, because people realize that, they're like, do I want to help this system or do I want to help that system? And we're finding the same things true for, doctors and executives. They leave these large systems because they're beautiful people. And they're like, we can't in good conscience continue to build systems that increase the cost of care in this country, that decrease the value of care in this country. It doesn't make sense. So that's where we come in.
Great, and these are all great questions. We have loads of questions from the audience, so thank you. I'll, with just a few minutes left here, Grant asked a question about the consumerization of healthcare, and I too am very interested in that. My own GP has recently switched to a pay-for model where I have health insurance, but I'm now paying, I'm not even going to share with you how many $1,000s to continue using my GP through MDVIP, which is a local South Florida company as well, right? So can you speak to the trend around consumerization of healthcare?
Yeah, so I'm so sorry, Kendall. By the way, we give our employees have a smaller ratio than MDVIP and at no additional cost. So FYI, if people want to join. But yeah, it saves you money right away. So it's no cost to the patient, okay? Because with the way that we pay for this concierge medicine is we're able to prevent hospitalization. If you prevent a hospitalization, each hospitalization is $15,000. So for each hospitalization that I prevent, I can give concierge care to 3 to 5 additional people at no additional cost. That's it. Okay. So that's the simple model. Now, in terms of the consumer, what kind of like net promoter scores do you think we're going to get when all of our patients, our old, poor, sick patients, get their doctor's cell phone numbers, get free door to doctor transportation? They get love calls. They get toilet paper delivered to their homes. They get executive physical head to toe every year. They get, on-site medication delivery. They have Zumba classes and Tai Chi classes on site at no additional costs. They have on-site specialists. We come to your home. If you don't pick up the phone, we will come and knock on your door because we're worried that you fell. Okay. That's the reason why that our net promoter scores are so high. So the key is our model is consumer-centric. You are not a transaction in our model. You're not another body that we can bill. Well, you're not. You are a human being that we can heal and we can love. And we use tech to help us do that better than anybody else could. That's the model. And that drives amazing consumer response.
I got a question, one follow-on question, Dr. Chris. Is there a criteria to be a patient in ChenMed? Because you said all these great things. I want to be a patient, but yeah.
So there's need everywhere, right? There's need everywhere, but our calling is to help seniors. We are a senior specific practice because those are the ones that are at most risk first: old, the poor, and the sick. And those the seniors that we take care of, they're typically in underserved, but they're all actually in underserved communities, and they enroll in something called Medicare Advantage, which is a version of Medicare. So if you have Medicare, you qualify at no additional cost for a Medicare Advantage plan, and we can see you. So essentially, we qualify for about 61 million Americans. Unfortunately, that's short of the 330 million Americans that are out there. But we've got to take care of the most vulnerable first, the ones who are at risk for dying first. So that's our goal. As soon as we get to that 500 cities. We can't wait to immediately, spread the model beyond that. And we also think our technology will have tremendous transferability to other populations as well. So that is a way for us to grow beyond the senior population very quickly.
Well, I want to thank both you and Hernando. This has been a fantastic, this is probably one of our best programs of the year as far as having the clinical view, having the technology view. And I think everybody on this call says this does affect ourselves. We're in that gray tsunami. There's a lot of people out there that are older. They're all starting to understand what it means to be in Medicare. You might have had different kinds of care, but you're starting to fall into those worlds. So I really applaud what you're doing, and I wish you all the best. If anyone out in our audience has additional questions, we encourage you to email us, and we'll get that over to the ChenMed team, and we'll get some answers for you. Other than that, we want to thank you and wish you a very wonderful the rest of your day and your afternoon. Thank you very much.
Thanks, Dr.
Thank you, South Florida HIMSS. Thank you, guys.
Thanks, Hernando.
Bye.